Hello, my name is Dr. Jeff Aberle, and if you have low back pain where when you're sleeping, if you're on your back, you have to have something underneath your knees, otherwise you have low back pain, and you can't put your legs straight, or you just avoid laying on your back altogether because it's too painful, then this video is going to explain why. Or if you lay on your belly, or you're just face down, laying belly down on the floor or something like that, watching TV, and that increases your low back pain, this will really be educational for you as well. Everybody has the tightness that I'm going to be talking about, but the people that have those symptoms of laying on their back or on their belly and a lot of low back pain, they have it really intensely. So what you need to do is you need to be able to take a low back that's, really stressed like this one and get it to do that. And that's what the low-level lasers do. Just by shining the laser beams right in this area, the muscles just start letting go, usually within 30 minutes of being on the table, and it just freaks people out because they feel their low back letting go like that, just by doing the lasers in the front of the pelvis. So I just want to show you a little bit about what's going on here. When anybody ever has low back pain, the muscles of the low back are usually looked at as it being a primary cause, or the discs, or people with a sciatic pain running down the back of their leg. But oftentimes what's going on is these muscles right here are very, very tight, yet they hardly ever hurt. Whenever I see somebody come in complaining of pain in the front of their hip like this, I'm surprised because it's so rare. People hurt on the outside of their hip all the time, but not in this area. So what we're dealing with here is this muscle here is called the psoas, this big one there, and the one behind it is called the iliacus. And you can kind of tell where it goes back there is because it, with this blue outline, you can see where it is back there. But together, these make the iliopsoas tendon that comes down here and connects into the inside of the femur. Now, what this muscle is primarily used for is to bring your leg up, right? To bring your knee up. And so that's when you're standing. When you're laying on your back and you have to do a full sit-up, when people have to hold you by your feet, and you hold that down, then you can do a full sit-up. These are the muscles you're using. And this is one of the reasons why full sit-ups are not good, is because this muscle here is attached to all 5 of your lumbar vertebrae. Here is L1, here is L2, L3, 4, and 5. And then this is your sacrum. And so you can tell this is attached to all 5 of those vertebrae, okay, right along into the bodies. So that's why you don't want to do regular normal sit-ups. Crunches are great. Normal sit-ups are not because of the connection down here. So what happens in these muscles is there's actually a chemical problem where the cells of the muscle are not making enough energy. And these muscles get into a rigor mortis effect where they tighten, and they're real tight, and you can't loosen them through stretching. In fact, stretching is pretty much useless for this. The lasers go in and restore the chemical production of energy, and the muscles relax. It's very similar to a rigor mortis effect that happens when people die. They can't make enough energy, and the muscles go into hard contraction. And it's unlike any machine you've ever seen in the world. Like when your car runs out of gas, it doesn't go into reverse real fast and hard, right? But muscles, they go into stiff contraction when they don't get enough energy production. So in a living person, you can have this energy production happen as well, this decreased energy production problem, and the muscles then stiffen up. And stretching it, like I say, is pretty much useless. The laser light restores the energy production, and boom, this stuff starts relaxing within minutes of being exposed to the laser light. And so that's fun. So if you look, we'll just look here at this person standing there, and we'll just go back to ideal. So that's ideal. And if these muscles are real tight in the front, what they do is they'll do something like this. They'll pull that whole pelvis forward. And so that's good, that's not good. Now, hopefully you can imagine here that the back muscles, which I'm not showing here, how they would have to then tighten up to fight against this tightening. So this tightening in the front is due to this chemical problem. The tightening in the back isn't always due to the chemical problem, it's due to fighting against this thing in the front. So what you have to do is get that to relax. So anyway, there it's stiff, and if we again lay the person on their back, so that's crunched and pulled forward, but if we put something underneath their legs, see how it relaxes the back? So painful, not painful, painful, not painful. But even this might not be good enough for the person to feel decent at night on their back, so they might not even sleep at their back at all, because their knees have to come much more forward, so they sleep on their side because that's comfortable. And they can bring their legs more forward on them, taking even more stress off. So if we go back to the painful condition again, then as you laser this area right through here, boom, the low back just lets go. And people feel that on the table. They feel that loosening, usually during the 30 minutes time that I got them on the table. And it is so fun to just kind of blow people's minds with that, having this light shining on muscles you wouldn't think would do anything. But it has a profound effect on the chemistry of the muscle cells deep down to the mitochondrial level, influencing trillions and trillions of mitochondria. So very cool, very fun. And again, trying to stretch this out, pretty much useless. It's just not going to work. You got to expose it to the light. And so anyway, that's just a quick video on the lasers being used in this area to treat low back pain. Now, just real quickly, if you're a practitioner and you have the lasers, you're going to check these, and pretty much everyone's going to have this problem. They're going to have it kind of right through this vicinity right here. And you put the person on their back and you just feel in this area. And, the tendon that runs from here down to here, or the ligament, I should say, the ligament that runs down from there, that's kind of the area you're talking about. But this whole thing here will feel hard and tight and stiff. And you kind of have to feel it with the person on their back with their legs stretched, or their legs just straight out ahead of them. That creates enough of a stretch to feel this. So you just go ahead and laser that area. If the person happens to have left low back pain, then you might want to just do the left side psoas area. If they have both sides, then you can do both sides at the same time if you have a machine that does that, or do one side at a time. Either way, you just want to loosen them up that way. It's very fun. If you do this area here because it's tight and it doesn't really make any difference in the back pain, well, maybe you want to go to the back and laser that, or it's some different problem entirely. So you can use the lasers to help differentially diagnose people, to try to figure out what's wrong with them. Now, if you're just going to do it for a minute, it's not enough to get these muscles to show some good improvement or relaxation. You have to do it for a while. This isn't upregulation where you're trying to make a nerve function better. This is really trying to get rid of this rigor mortis effect. And using the Erconia low-level lasers, you just have to do more exposure time. And 10, 15 minutes will start getting you that effect. But you can go longer than that without any problems. I'll do this area on people sometimes for an hour, hour and a half, and I don't have any issues. Now I'm moving the lasers around a little bit, just pointing them in different directions a little bit here and there as I go, but there's just no issue with it. So anyway, I hope that was helpful for you, and I hope that you get some laser treatments on yourself to get this taken care of, because this is a common problem. Everybody has this tightness in here, just to what degree. The people that are in a lot of low back pain are going to have a lot more of this than the people that don't have a lot of low back pain. Pretty straightforward. So my name is Jeff Aberle from Madison, Wisconsin, USA. Have a good night.